Hi, I'm Julianna Monceau. I am a nurse practitioner with Dr. George Joshua at Austin Labiaplasty and Vaginal Rejuvenation. I am going to talk to you today about labiaplasty revisions. So women will come see us due to unsatisfactory results, both from like a physical and aesthetic standpoint. One common reason would be a surgeon didn't take off as much tissue as they would like, or maybe the surgeon wasn't comfortable doing a clitoral hood reduction. So then their labia minora may have been reduced, but then they're left with this kind of excess tissue at the hood, and it's aesthetically basically displeasing. Other types of labiaplasty revisions, and I'd say one that's pretty common, is women who have had a labiaplasty or clitoral hood reduction, but then maybe they took some hormone replacement therapy later in life, and that can result in either a regrowth of some labial tissue or certain parts of the labia, but also growth of the clitoris. And so we're often going in and doing procedures to tuck in or reduce the size of the clitoris, along with like a repeat hood reduction. So prior to considering a revision of any kind, you want to wait a minimum of 12 weeks since your last surgery. This is going to give the tissue enough time for the swelling to go down, for any soft scar tissue or firm areas to really soften. In fact, we really won't see any patients earlier than 12 weeks for this reason. The longer you can put in between an actual surgical revision between surgeries is ideal. The main difference between Dr. Joshua and a plastic surgeon is Dr. Joshua is a urogynecologist, so he's an expert in female pelvic anatomy, as well as labial and vulvar anatomy and clitoral anatomy, and not only from a anatomical standpoint, in the sense of like appearance, but also in a functional standpoint. So having a good understanding of the function of the clitoris and the vulva and the vagina really makes him an ideal surgeon to be able to operate, so that we can address not only aesthetic concerns, but also functional concerns. When you come see us for a labiaplasty revision, the consult can be done either in person or over the phone, and then we schedule the procedure typically to be an in-office procedure. Revisions themselves, the length of time really depends on exactly what we're revising and how much work essentially needs to be done. Minor, where it's only a 30-minute procedure and the recovery is quick. And pain medication may or may not be needed after. Other revisions, especially when we're talking about hormone-related changes of the labia or the clitoris, those can be a little bit more involved and can be up to a few hours, and then therefore the recovery can be a little bit longer. So a labiaplasty revision could be anywhere from 30 minutes to 2 hours. Give or take a little bit of time. And this really just depends on exactly what we're revising and what part of the anatomy we're addressing. So labiaplasty revision healing process can be similar to the initial labiaplasty depending on the type of approach that was done for the initial labiaplasty. I typically counsel women that if we're doing a complete revision of the labia minora, the clitoral hood area, and or the clitoris, that is going to be more similar of a recovery than to the initial surgery. And sometimes if we're even doing more work, it can actually be a little bit more extensive of a recovery process. However, for the most part, women who are coming in for revisions, we're really just focusing on one part of the anatomy, and therefore you could see the recovery process short as a few days or up to a couple of weeks. The cost of a labiaplasty revision is going to be similar to our cost for a full labiaplasty. And this is because that we're often going in and doing a total reconstructive approach to give the results that patients are looking for. A labiaplasty revision is typically not covered by insurance. So we often perform clitoral hood reductions with labiaplasties because when woman's labia minora is enlarged, their clitoral hood tissue is also enlarged. And so to get a more naturally aesthetic appearance post-op, you'll want to reduce the clitoral hood so that there's a seamless transition and symmetry of tissue throughout. If you deferred the clitoral hood tissue and it's enlarged and only did the labia minora, then oftentimes after the surgery, the remaining clitoral hood tissue or the clitoris can have a drooping or an enlarged appearance. So depending on the reason for the labiaplasty revision, in order to prepare, it may be as simple as just shave the area the morning of, and then we'll give you the instructions for the rest of the visit, like certain medications to take before the visit and post-op pain control afterwards. Others, if you're getting a revision, maybe because you've had some clitoral enlargement due to hormone therapy after a labiaplasty, then we're really going to counsel you on making sure that the size of the clitoris is stabilized. And this may mean working on the dosing of the hormones you're on to ensure that the results you get from the revision are going to not change due to hormone fluctuations. So like when we are addressing patients' concerns, one of the first things we always like to tell women is think of the labia as sisters and not identical twins, right? So there's going to be some changes between both sides. Perfect symmetry is very rarely achieved, and that's going to be for different reasons, like the way the clitoris and the labia connect at what's called the clitoral frenulum, or perhaps some natural folds in the tissue in an area that isn't really quite operable. So coming in knowing and understanding that these changes from side to side will also help to set better expectations. But with that said, we're always happy to take a look because like maybe you can't quite pin what you're unhappy for or with, and where we can say, hey, well, you know, there wasn't a clitoral hood reduction done, and I think that that's what you're really looking for, is to get everything nice and kind of tucked in and a little bit more even all the way around, and we can offer those types of suggestions. After the revision, like if you're still kind of unhappy with a certain area, we really need to target like what's causing that unhappy. Is there scar tissue buildup? And is that causing some like major asymmetry or firmness or changes in the appearance? Or does it have more to do with like the color of the tissue, right? Where perhaps there's some darker tissue in an area that doesn't look the same on the other side, or is just really, we're unable to remove that portion of the tissue. And we can work with you throughout the process and the post-op period to really see if there's something surgically we can address, we certainly will. And if not, then we talk about other options, like maybe refer you for intimate bleaching, or maybe the area in question doesn't really have to do with the labia minora, but has to do with the surrounding tissue or the vaginal tissue. And then that's where we can kind of talk about different options for that as well. At AUG and Austin Labiaplasty and Vaginal Rejuvenation, we have the clinical expertise, right? Where we are experts in both vaginal and vulvar anatomy and pelvic floor anatomy. Clinically, that means you're in really good hands. But outside of that, I think a good thing to consider, and one thing that sets us apart, is that we can address multiple concerns at once, right? So let's say there's a concern with both the actual vaginal anatomy and function of the pelvic floor, but then there's also this aesthetic concern of the labia minora, or maybe the mons tissue, or the labia majora. Well, we really can address everything, and oftentimes we can address it all at once during a single surgery. And then, you know, the other side of us is just our team. I think that does set us apart. We're a small team with 2 or 3 nurse practitioners, Dr. Shashua, and then we have a team that includes like our administration team. And we pride ourselves in being friendly. We like to think we're approachable. We enjoy working here, and I think that does translate to our care. I think we're very responsive. It's probably one of the things we're most proud of, is that we're always available Patients typically find that they feel really comfortable to be able to talk about anything that they want to talk about, and usually a very intimate subject matter. We pride ourselves in being available, approachable, and friendly, obviously while providing good clinical care. And just the availability part is, I think, very important, especially with our surgeries, because you know, it's not very well known how the recovery process goes. And having somebody like a nurse or a provider available to answer these concerns quickly is really important, because that's not always the standard of care in medicine now. It can be hard to get a hold of doctors' offices and get immediate answers, and that's one of the things that we pride ourselves in. If you've had a labiaplasty and you live outside of Austin, outside of the state, even out of the country, we can do these revision consults over the phone, no problem. And so that process looks like where you call our office, you let us know what you're interested in, we'll set up a phone call, and we'll give you a way to upload photos in a secure manner. And then we'll review your concerns, questions, and essentially take care of the entire consult via telemedicine. Then you would fly in the day before the surgery, meet Dr. Shashua and the team in person. The next day will be the procedure itself, which is done in our office. And then we will see you the following day after the procedure for a quick post-op visit. The rest of the post-op visits can be done online as well, similar to your consult, or we give you the option to fly back in if you need to. So overall, pretty easy process, and it's something that we do for quite a few women. Coming in and traveling, especially from out of town for a labiaplasty visit or a labiaplasty revision, can be kind of intimidating, especially if you're looking to travel solo. So we're able to give you information on local hotels, areas of Austin to stay in, and as well as set up medical transport, because you'll need a secure ride to take you to the procedure and also bring you back to your hotel or Airbnb after the procedure. And so we'll give you all the information needed for that, and make sure that you feel safe and take care of the entire time. Thanks for listening about labiaplasty revisions. I'm Julianna Monceau, nurse practitioner and surgical assist with Dr. George Shashua at Austin Urogynecology and Austin Labiaplasty and Vaginal Rejuvenation. Thanks for listening in, and please subscribe to our YouTube.